Right. So the reason I chose this topic, I think Michelle was telling me that they want something different. They have heard about cannabis, CBD, they have heard about other integrative therapy, but this is something about ozone specifically. She was saying that they do not know much and they want to know more about it. So I decided to do this. So antioxidant therapy is not a new theory. It's been around in the field of medicine for over 50 years. So it started roughly when vitamin C was discovered, and then it was used for its antioxidant property and antiviral properties, and it was used extensively in the 1950s and 60s because antibiotics were much less used at that time, and then slowly it faded away. And then in the 1980s it kind of picked up momentum again, and over the last 10 years specifically we have a lot of research that is coming in this area, and it is a very fast growing area, I would say. So the reason I am giving you a background is so that you know why you're doing what you're doing. I think it is very important rather than just blindly doing something because some people are saying that it works. Okay. So this is a very nice statement. The adequate functioning of the host immune system depends upon an adequate supply of antioxidant micronutrients. Okay, so now what are these antioxidant micronutrients? So when we breathe, okay, the most simplest thing that we do is we breathe, right? We breathe and oxygen goes in our body. It sets off a chain reaction, and this reaction produces a lot of byproducts. Okay, these are oxidants. These are byproducts. So they are waste products and which causes oxidative stress in the body. The reason they are called as oxidants is because they have a free electron and they immediately want to go and latch on to anything that they see. So they go and latch on to sometimes proteins, they would latch on to other tissues, they would latch on to RBCs, they would latch on to WBC. So wherever they find a free electron, they will go and they will try to neutralize them. So antioxidants are those molecules or those substances which provide this free electron to that oxidant molecule. All right. So that is how it basically works. Now, the theory is that most of the chronic diseases, especially when we are seeing aging related diseases, like you have autoimmune conditions, you have neurodegenerative conditions like Alzheimer's, Parkinson's, dementia, cardiovascular diseases, atherosclerotic heart diseases, or chronic renal failure. All these diseases, there is a theory that it usually starts to set in when there is an imbalance of antioxidant system of the body and the ROS. ROS is the reactive oxygen species, the O radical, which I was talking about. So when there is this imbalance happening, slowly, this reactive oxygen species starts damaging the organs. It could be kidneys, it could be liver, it could be heart, it could be brain, and in case of RA, it is the joint. So this is the concept of the antioxidant theory. Now, I won't say it is a very foolproof theory because it does not work in all cases, but it also works in some cases. I'll tell you why that happens as we go further. Okay. So now, how do we apply this theory in case of RA or rheumatoid arthritis is what I'm going to explain. So the first step of RA, see, it's a very complex disease. Okay, anybody who comes and tells you like, oh, this one particular thing is the cause of your RA, they are absolutely lying to you. Okay, because that never happens. It is always multifactorial, and those who you are suffering from it also realize this thing. I'm sure that there could be multiple triggers which sometimes you are even not aware of. Okay, so the first step in any autoimmune process is the trigger. Now, the trigger could be genetics, okay, and there is a strong association between genes and autoimmune conditions. It could be environmental, and in environmental, there is air pollution, there is water pollution, heavy metal toxicity, pesticides, all of that comes. There is definitely stress. Viruses and bacteria. This is also quite important because I have seen cases of RA after dengue fever. All right. So just 1 2 months after dengue fever, they have developed rheumatoid arthritis. RF factor is quite high. And there is also this myocarditis, autoimmune myocarditis, or heart issues which sets in when the throat infection, streptococcal throat infection. All right. So this is another reason. Then the last is lifestyle. So whether you're smoking, whether you're drinking, how is your sleeping habit, all of that, weight, etc., all are triggers for autoimmune condition. Now here, when you see, I have put in bracket something called as ROS. Now, what do you mean by ROS? So ROS, or reactive oxygen species, is generated because of these processes. So let's say you're exposed to air pollution. Your lung has to detox it. In that process, it releases reactive oxygen species. Similarly, let's say you are stressed, extreme stress, something major has happened in your life. When you are undergoing that emotional and physical process, the body releases reactive oxygen species. All right. So ROS is the byproduct of all these reactions which happen, which I have named as trigger. Okay. And the reason I have put an asterisk next to it is because they can also be triggered by nutritional deficiency. Okay, I'll explain you this. So when a person is having a viral fever or a bacterial fever, during the acute phase, during the fever, the body is using all the nutrients that it can to fight the virus or the bacteria. So post the viral or post the acute, the body goes into deficiency. So this can happen. Also our lifestyle. So we don't eat nutritious food mindfully over decades, it is always up and down. So there is a deficiency with it. So it could be a relative deficiency, that is, as I said, the body is using more of it, or it could be an absolute deficiency in which you're not getting enough through food and through food. Now, after this trigger happens, the inflammation sets in, autoantibodies are formed, the RF factor, all that is formed, cytokines are released, and these antibodies also release reactive oxygen species. Now, you see, it is a circle. ROS causing the inflammation, and the inflammation causing more ROS, and it goes in a kind of a positive feedback mechanism. It just keeps on adding, adding, and adding. Okay. And after that, you see joint destruction. You can see muscle fatigue is there. Sometimes people get fever. So this is all the reaction from the byproducts which are released of the inflammation. All right. So here we see that ROS can also be a cause of RA. At the same time, ROS can also be a byproduct of RA. So both ways, antioxidant therapy can help. All right. So now, what are antioxidants? Where do you get antioxidants from? The first major source is obviously your food. All right. Now, here I'm not talking about food because I think you all know a lot about diet. All fruits and all vegetables are filled with antioxidants. Even the spices which we use, like haldi and cumin and all those chili, all of it. So they have certain molecules which can act as antioxidants. And when you consume a lot of vegetables and fruits in your diet, especially berries, they are rich in antioxidants. So your body's antioxidant load goes. All right. Now I'm going to be talking about supplements, or what other things can you do for and to increase the antioxidant load in the body. So the first supplement that I like to use is vitamin E. And vitamin E is not just in RA, I also use in especially PCOD, fibroadenoma of the breast, fibroids of the uterus. So these are other conditions where I use vitamin E and I've seen very good results. Okay, and it's very interesting that the macrophages, or the cells which fight the infection, they are deficient. If they are deficient in vitamin E, they release even more free radicals. And vitamin E also protects against the effects of cortisol, because when you take cortisol, and a lot of RA patients are on steroids like Wisplone, it will have an immunosuppressive effect. So vitamin E can kind of help to protect against that. Then you have carotenoid. Carotenoid is a huge, you can say, class of antioxidants. So that include astaxanthin, beta carotene, lutein, etc., etc. So all these things, they improve the helper T cells and the natural killer cells in our body. Vitamin C is very beautiful for enhancing the immune system overall. I can vouch for it. I just put kids on vitamin C and zinc supplements, and their allergies disappear, their repeated cold cough disappears. It makes a huge impact in their life. I have seen that personally in my practice. Glutathione, it's an expensive antioxidant, but it enhances your body's immune system very well. It's one of the most potent antioxidants that we have. Coenzyme Q10. This is very important for the mitochondria of our cells, and it's also a very important antioxidant for brain and heart health. Zinc, again, as I said, I use vitamin C plus zinc to, enhance the overall immune system. Omega 3, very good for the brain as well as the joints. So in RA, I use it very commonly because it basically increases the release of anti-inflammatory prostaglandins, which are also made of fats and steroids. So that's how it works. MSM glucosamine, again, a very beautiful supplement that I use in RA patients. It loosens up the joints, it improves inflammation, it also improves muscle health, it strengthens the joint, it has a lot of benefits. And then lastly, of course, magnesium. Magnesium is multi-pronged, so I use it for improving the sleep, improving the brain health, that brain fog and all comes, that also disappears, for improving spasms of the muscle, and it also enhances the immune system. It is used as a cofactor in many enzymatic reactions in the body, and it also helps to reduce stress. Okay, so these are not, exhaustive. These are just the important ones which I have given. And depending on the person, depending on the symptoms, depending on what, sometimes I take the history and I feel, okay, they might need a grape seed extract or they might need something else. I would suggest that. Okay, so this is by far a very generic thing that, if you can start with these, you will see a lot of improvement in your symptoms as well. So let's talk about the big thing that we are here to talk about, the ozone therapy. So ozone therapy works on the same principle of antioxidant. Okay. So ozone is basically O3. It has got three atoms of oxygen, whereas oxygen has O2, right? It has two atoms. So ozone has O3. So when it goes into your body, it first splits into oxygen, which is absorbed, and it causes good oxygenation of the tissue, and the O radical. Now, this O radical goes and sets off a chain reaction by which the antioxidant mechanism of your body itself starts getting strengthened. It activates the internal body's internal antioxidant system like glutathione peroxidase, and there are few other enzymes which are used. So this ozone, this O radical will go and set off that chain reaction which happens. So this is what mainly ozone therapy does. So the first thing that, as I said, it does, it balances that redox. You remember that in the second slide, I had shown you the balance, right? So it balances the oxidative stress versus the antioxidant properties of the body. So it helps to do that. The second thing it does is it increases synthesis of the prostaglandins, the anti-inflammatory prostaglandins, which your body normally also secretes to reduce the pain, to reduce the inflammation, but it promotes more synthesis of that. Then it also is used as an immunomodulator. So it directly affects the WBC, okay, and that's how it helps to modulate the immune system, especially in RA and other autoimmune diseases also. It is a metabolic regulator. It works very beautifully on the liver. It improves insulin sensitivity. So it is used in diabetes also. I have seen some very good control, sugar control, once the patient starts with ozone. It also helps with peripheral neuropathy, which happens in diabetes. So yeah, so it helps in metabolic regulation. And as I said, there is a lot of oxygen which is released along with the O radical. So this oxygen, it oxygenates the tissue. A lot of the times our tissues are not getting enough oxygen, and this helps to counter that. All right. So these are the five main mechanisms through which ozone actually helps. So what do you expect in ozone session? All right. So ozone is produced. So there will be an oxygen cylinder. That oxygen cylinder supplies oxygen to the ozone machine to generate the ozone. Now that ozone can be given either externally. It should not be breathed like directly inhaled ever, because it is very, very toxic, and it can cause extreme irritation of your throat and nose and all of that, and it can also lead to suffocation. So it's never directly breathed in. So you either apply it on the skin, on the scalp, it is given through ears, and through the nose, you actually bubble the ozone through an oil, olive oil or sesame oil, something like that. And then you breathe whatever is bubbled out of the oil. So you're not directly breathing the ozone in any way. These are external applications. Internally, we do rectal and vaginal. I usually start with rectal ozone for almost all my patients because you need ozone to go into your system. Externally you can give if there is a skin condition or there is a joint pain very severe, and you want to directly go to the joint, okay, little bit you can do. But rectal is what gives you a very systemic, what do you say, systemic exposure to ozone. And then you have invasive procedures where you're giving injections. It could be intramuscular, it could be around the joint, which is periarticular, it can be intraarticular into the joint. And we also do through the blood. So we take out the blood, we mix it with ozone and transfuse it back. It's called as autohemotherapy. So that is also done, but that is very advanced. We do not do that in the beginning. So the beginning of the ozone therapy is usually rectal sessions or vaginal sessions, depending on the patient, and we do injections for pain, swelling, etc. Okay, and one thing to remember is that since it's an antioxidant therapy, just one sitting will not, or one session will not cause too much of difference. You have to do it repeatedly because the oxidative load is so high in the body because of what all I just talked about. One session will not give you that relief. So minimum 8 to 10 sessions I always suggest. Then we take a break for 1 to 2 months, and then we again do 8 to 10 sessions. That being said, I have some patients, like especially autistic kids, who bought the ozone machine and kept it at home, and they've been doing it to their child, for their child, for like 1 2 years, and also, and they are seeing very good results. So people have also done that, but as I said, you need repetitive sessions. And for RA, you can give periarticular, that is injections around the joint, injections into the joint. There is also something called as prolozone injection, which is again a little advanced treatment that we do. And the blood, which I said, the major autohemotherapy, that can be done as maintenance. Once in 2 months, you can take that blood transfusion with ozonated blood. That also gives a good relief. I remember there was a patient, I had seen her in the when I was doing my training. She was suffering from MS, and she was taking major autohemotherapy once in a month since 5 years. She's been doing that. So she used to come to the center just once a month, get it, and then she would. And she would say that for 1 month, I would have very good energy levels, and my MS symptoms would subside, and all of that. So that is the effect of major autohemotherapy that we do. Okay, but remember that it should not be the first thing that you do. It should first you start with rectal, or you can do ear, and then slowly move on to other advanced therapies. That's what I would suggest. So now, what are the challenges? Every therapy has its own challenges. I'm not. I'll never say that anything is 100% effective. With oral supplements, there is an issue with bioavailability, which is how much of the supplement which you're taking is actually available to you. Usually it is 20 to 30% because a lot of it is gone in your absorption because you don't absorb things well. Sometimes it is gone in the liver detox. So roughly 20 to 30% is only available. So that way you have to set the dosage so that you are able to get what you need. And ozone therapy bypasses that because there is no problem with absorption or digestion and things like that. And for supplements, we can do intravenous supplements, like you can take drips, like we take saline drips, right? So like that, you can take drips of vitamin C and other antioxidants, B complex, N-acetylcysteine, glutathione. So all that you do, that's why people do prefer sometimes IV therapy, because you know that whatever you're taking intravenous, it is 100% available to you. And the result is very instantaneous. Like next day, they will say, my energy levels are more, my mood is better, I feel very light. Immediately they will say, because of this digestive issue is not there. Ozone therapy, as I said, requires multiple sessions, repeated sessions, sometimes repeated every 2 to 3 months, depending on the severity of the problem. IV therapy also needs maintenance doses, and obviously it is invasive. So you prick, and it has to be done. So it's invasive, and the right type of antioxidants that you choose is important. Like I said, coenzyme Q10 is very good for brain and heart, for example. So when you have a person with brain and heart issues, you have to give them coenzyme Q10, or fertility issues, you have to give them CoQ10 as part of their antioxidant protocol. So depending on certain organs, certain antioxidants are a must. Also, I have seen that in some people, some will work better, whereas others don't work. So it's a little bit of trial and error also sometimes. But this is what has been my observation. Then the quality of oral supplements that you're taking, that is also very, very important. And in ozone, this problem is not there, because whatever ozone you're getting, it is ozone and it is good quality. It is made from 99% oxygen. So the quality issue is not there. If triggers are not addressed, for example, the person is also smoking at the same time, also drinking a lot of alcohol, or not maintaining good sleeping habits, or doing nighttime shift. So if this is not addressed, then antioxidant therapy will not do much, because all your antioxidants will go in neutralizing the oxidative stress of the triggers. Like if you're drinking, whatever oxidants are produced in that, this will go and utilize that. So it will not have any added benefits for you. It will just help to prevent the damage, you can say. And another thing, very important thing to remember, is that this is part of an integrated treatment protocol. Standalone, it may help, it may not help, but I always say that always integrate it. So I always integrate it. I give homeopathy. Sometimes worst cases, we have to resort to painkillers, we have to resort to disease modifying agents also. It can happen. So make it as part of the treatment protocol rather than keeping it a standalone treatment, especially in RA. I would suggest that. So thank you. That brings to the end of our presentation. I'll just stop my screen share. Yeah. So I'm open to questions. I ran through the presentation because I wanted more time for the questions. So
Dr. Shruti, Asha here.
yeah.
I have few questions because I'm taking CBD oil. I'm doing ozone therapy also. So it's been 2 months that I'm on ozone therapy. I've got the setup at my home, so I do it every day. I'm also taking ozone injections and also the blood what you are.
Okay, so I think we have to end the discussion here. Thank you so much for joining today. I will put this recording on YouTube so that it's available for everyone. And yeah, and if you have any questions, I think Michelle is there. She can coordinate. You can ask her, and she can
Ma'am, I'll take your
guide
number
you.
from her. So
Sure,
just say her, okay?
sure, sure. All right.
Okay, thank you.
You.
Thank you, Dr. Shruti, for your valuable time and guiding us.
Thank you, Asha.
Thank you.
Hello. Bye. Have a good
Bye
day.
bye. Thank you. Good day.